I'm going to start, and anybody else who comes in will hopefully be able to pick up afterwards. So thank you all for coming. I'm not sure if you are brides to be or you're going to a big wedding or a party, but this is just a crazy time. I was saying yesterday to my team that out of 11 patients I saw yesterday afternoon, 5 of them were brides to be. So all these people getting married, exciting times, fun times, but also, everyone's trying to look their absolute very best. So thank you very much for joining. I'm going to go over both skincare and just a little bit of advice on what to do in the lead up to having your wedding or whatever event that it is that you're going to. So I'm going to start from 2 months. Basically, the best routine that you can do is the one that you're going to be consistent with. And really, a few months before your wedding, and ideally even 3 months before your wedding, you really start on a good, consistent routine with nice actives. That gives it enough time for the skincare to work. And also, if for some reason you have some unusual sort of reaction with any product, that you obviously don't have any, that doesn't impact your big day. So what does that consist of? So in my opinion, you should always reveal, enhance, and protect the skin. And what that means is that you need to cleanse really well so you can get rid of any of the dead skin debris. Really creates the foundation, a palette, so that any of the nice actives that you're going to place on top, you will then place on top. And then finally, you need to enhance with these different actives, whether it's antioxidants, whether it's hyaluronic acid, retinol, stem cells, niacinamide, lots of different ways of enhancing the skin with topical actives. And then finally, to protect. And again, protection doesn't just come in the form of SPF, which is very, very important, but it also comes in the form of antioxidants to help prevent oxidative damage and help reverse that damage. So that's the consistency that you need to have. You don't need to have too many different products, but you should have at least those 3 steps. And there's certain ingredients that I think everybody should have in their skincare armoire. And that is, at any age, by the way, is to have the SPF, as I said, to protect, also to have the vitamin C and the retinol. And I think those are 3 important essential skincare ingredients for all skin types at all ages that will benefit and give you healthy, glowing, radiant skin. So that's my trio, my famous trio. But what should you do for the 2 months before having your wedding? One of my favorite ingredients is our Brighten and Perfect. It's vitamin C. And I love this product because it's a serum. It's incredibly light. I'm just going to open the cap, and you can use it in the morning and the evening. Basically, sorry, this one's new, so I have to turn it the other way. So basically, it has a very light consistency. It's a serum, not super thick, and you can just put it on, and it just is very light, but very hydrating to the skin. So this is packed with encapsulated vitamin C, as well as azelaic acid, which are both skin brighteners. Vitamin C is a building block for skin itself, so it helps increase collagen production. So that's going to make your skin look a little bit more dewy in the long term. Also a great skin hydrator, as well as a brightener. We also have hyaluronic acid in it, which is where the hydration comes in from, but then brightening. So vitamin C helps decrease pigmentation from sun exposure, and also helps to redensify that skin. So think about fine lines and wrinkles. So as I said before, just a powerhouse ingredient. It helps collagen production, helps decrease pigmentation, and helps to give your skin that glowy, radiant look. And again, it has azelaic acid, which is also not only brightening, but it's also really good for inflammation of the skin. So it's a calming effect. Vitamin C is one of those ingredients that I just can't live without. So that's what I would do in terms of prioritizing your AM serum. And in the evening, as I mentioned before, that's when I would use this retinol skin booster. And this is really a lovely product that has, retinol, 2% retinol, and it's a drop. It's the last thing you do in your skincare routine. I put a few drops in my hands and I put it on top of my face. And what retinol does is, again, it helps increase skin activity, And it also helps to boost your collagen production. So it increases cell turnover. Again, it's a skin brightener. It's a densifier for the skin. And it will also help to maintain collagen stimulation. So these are the two sort of things that you should add into your skincare regimen if you're not using them. The other thing that I'd like to do in office in combination with this is something for pigmentation called BBL, which is basically a souped up IPL. IPL is intense pulse light, BBL is broadband light, and basically that's using different wavelengths of light that target redness as well as pigmentation in the skin. So if you suffer from perinasal or blood vessels around the nose, if you have some broken capillaries on the skin, if you're rosacea prone and have a T-zone with just generalized redness, if you're somebody who's had a lot of sun exposure and lots of sunspots on the face, this is the type of treatment that you would do perfect for a couple months before the big day, because what it does is those areas of pigmentation become darker for about 5 to 6 days. And then they lighten up, and you need a series of those treatments every 2 to 4 weeks apart from each other. So ideally you could even start it at 3 months prior. So I think it's a really nice treatment to really give you glowing skin. Doesn't change how you look. It just makes it look like you have that foundation. Coupled with vitamin C and retinol, you're really going to have an excellent way to give yourself that radiant, beautiful skin. So that's what I like in office. At home, I also love to have the LED. And basically there's two different modalities on this. One is the red and one is the blue, which actually looks like purple. And basically the different modalities, the red is for regeneration and rejuvenation. It has red light as well as infrared light. And then the blue, which looks like a little bit purpley, helps with inflammation, but it's also really great for people who suffer from a bit of acne, because what it does is that it has an anti-inflammatory aspect to it, but it also helps decrease the amount of P. acnes, which is a type of bacteria that sits on the skin and contributes to acne. So a really nice way to, give yourself a glow and be able to do it in the comfort of your own home. It's for 10 minutes. It's self-monitored. You put it on, you relax. Very important to relax for that 10 minutes. And then afterwards, if you want to go out, you have beautiful glowing skin. And if you're using it as a treatment for instance, some acne, then what I would recommend is that you would place it on at least 3 or 4 times a week. If you're doing it for rejuvenation, even once, you're going to get that improvement, but you'll get continued improvement with each time that you use it. So just my favorite at-home treatment to use whenever you can. I also wanted to talk about a little bit of laser resurfacing and rejuvenation to help with skin texture. We have things in the office, or other doctors do too as well, things like a nano peel, which is basically using a laser to take the top few microns, like literally, microns of skin away. And what that does is it helps with skin texture. It also helps with pigmentation. It helps with fine lines and, very fine lines, and also with pores. So you can actually see the sebum in them. Sometimes they sort of evaporate. It's really quite nice to do. If you are somebody who has some acne scarring, or you have more, you're a little bit you're not as young as your 20s, and you want to have something a little bit stronger, you can have, either microneedling, which will help with acne scarring and doesn't have too much downtime, or you can take it a step further with something like Halo, which is an erbium laser that causes fractional ablation to the skin and really helps with pigmentation. It helps with skin density. It just makes you have beautiful, glowing, bouncy skin. So I love doing those treatments along, again, with the vitamin C and the retinol. I think that those are things that you can do all the time. You can, of course, use the red mask to help with healing for that too. So I think that's just something that you can use all the time. And obviously, if you're microneedling and you use the retinol, you're actually getting even more improved penetration of your ingredients, because you've created these little micro channels for the ingredients to go into. So I love actually mixing some meso in with the microneedling sometimes too, just to get that better penetration of the ingredients that you want. Now, if you're someone who feels like, your skin's dry, it lacks luster, and you just feel like you want to give it like a little boost to make it a little bit more glowy, that's where I love things like Profilo and Nucleophil And basically, Profilo is a type of hyaluronic acid that is like medicine for the skin. Someone told me it's like moisturizer in a needle. That's how they explained it to me. It's, a few injection points. You can do it on the face, the neck, the décolletage. And what it does is that it spreads. So you get these little boluses. And then over the next couple of days, it spreads and it really rejuvenates the skin from inside, helps promote collagen production, but it's not a volumizer. You will not get puffy. You will not get, full. You will not look like a pillow face. So it's not at all a volumizer. It's really for that internal hydration of the skin. And Nucleophil is something that's new in my practice. And it's new in the UK, actually. So it's a polynucleotide. So it's not even a filler. It's not hyaluronic acid at all. What it is, it's the building blocks of our collagen, and you inject it. And basically that also jumpstarts and it helps decrease puffiness around the eyes. It helps decrease redness. And again, it stimulates collagen production without volumization. So again, something that I absolutely love. And what I would add to that topically in terms of skincare is our hyaluronic acid serum, which is super light. And it's just divine. This is like one of my favorite go-to products because it just makes you feel instantly hydrated immediately. So really nice product to be able to use. You can layer it. So, you use it first in terms of any other product. So you'd always start with your serums first, and then you put your moisturizer and then an oil or an SPF, depending on what you're using. I think this is a good time also to talk about injectables. So I think a lot of people like to know about injectables, Botox, for instance, hyaluronic acid fillers, dermal fillers in general. And I would say that if you're going to go down the route of injectables, then I would definitely do it a little bit beforehand and perhaps even do a trial, months beforehand to see if you're going to like Botox. So, one of the places people always complain about are the number 11s in between the eyebrows. That's a perfect place at any point, a month before the wedding, up until a month before the wedding, that you can inject a little bit of botulinum toxin so you can't frown. So I can move my eyebrows, but I have clearly had some Botox in that area. So that's actually something really nice. Sometimes people are complaining about their crow's feet and they want to do something about that so they don't look so lined in their, photographs of the wedding. And again, a little bit of botulinum toxin or another neuromodulator in this area can actually help open and widen the eye area. So you can get like a millimeter or two even of a brow lift. And then if you have a lot of forehead lines, that's also something that can be done with a little bit of neurotoxin. And that's basically you're injecting the area of those muscles that cause lines from movement. So Botox will never help a static line. It only helps prevent or decrease those lines caused by muscle movement. So, like I said, I can't frown, or I don't actually get lines around my eyes. So I don't really have any here, but I do have a little bit in my upper eyebrow just to help open my eye a little bit. And then finally, you can do the forehead, which again, I'm not frozen, but I have some movement, but I don't have much. And so again, you can do botulinum toxin up here. And basically that functions to, help elevate the eyes, but also help decrease those wrinkles that form from the movement of that upper eyelid. Some people like to do a little lip flip. They don't want to have any filler in their lip, but they just want to have that little bit of a zhuzh. And so a little bit of Botox in this area can help flip the lip. Some, people, like my age, you get these bands, you can inject those bands with botulinum toxin too, or any sort of neuromodulator. And the nice thing about that is that, like when you're animated and you're so happy, you make all these weird faces, but then you won't see those bands coming down, which is really quite nice. So that's actually something that can be done as well. Another great place for Botox is underneath the underarms. You will not sweat for your big day. If you're having a summer wedding, you can do this up to 2 weeks beforehand. And what it does is decreases the amount of sweating. We sometimes do a little light spray on the face for some people who have a lot of facial hyperhidrosis, which is basically excess sweating. I've done it in the groin area, hands and feet are a little bit more uncomfortable, but you can also do it in the hands and feet. So lots of really fun places that you can use the neuromodulators like Botox and Dysport and Azelor. Fillers, on the other hand, are something I'd like to do a couple months before because they have long longevity. So at this point, you can do them without any problem whatsoever. So you can do it a couple months in advance. The nice thing about hyaluronic acid fillers is that it's reversible. So if for some reason you're like, oh my God, I hate what I look like, you can have it dissolved and in enough time so that you don't have to worry at all about your wedding. The reason I like to do fillers, dermal fillers earlier is also because there's always a risk anytime you do any injection in the face of having a little bit of bruising. And while most people don't have bruising, it's like Murphy's Law or, the catch-22, that when you have something really important, that's the time that you're going to have a little bit of bruising. So this is the perfect time if you want to have a little bit in the tear trough. If you feel like you're a little dark in that area, you can volumize that area. If you feel that you want a little bit in the lips or a little bit of contouring on your jawline or your cheeks, neck, I mean, literally anywhere. Sometimes I even put it in the soles of my patients' feet because they know they're going to be on heels the whole night and they want a little bit of cushioning. You might have heard that, people on the red carpet like to do that. It's not my favorite to do because it's a little uncomfortable, but it seems to help people tremendously in what they're doing. So those are the things that I would say. I would complement that again, both of those injectables with our retinol, with our vitamin C, and with our hyaluronic acid. And as I mentioned before, there's no better way to support collagen production with at-home treatments, again, with your LED light. So that's my little tidbits for a couple months before. A couple months before, you have a lot of options, and it's just really nice to be able to, look and see. And if you don't know what the best option is for you, that's where you have to go and visit someone like me or somebody that you trust who can give you a little bit of that insight as to what you may or may not be able to do. And it's, the earlier you do it, you don't need to do it too far in advance, but you should do it at least, a couple months beforehand so that you can get the best outcome and that you don't feel disappointed that you started too late. It's never too late to start, but sometimes you won't be able to get the result that you want if you don't start early enough. So a few months before, perfect timing to come in. 1 month in advance. So this is when stress is at its peak. You're like, oh my God, my guest list, people are coming, they're canceling, your dress, your food, in-laws, future in-laws, potentially even your own kids. I mean, there's just a lot going on. And so this is a time where people get frantic. They're also, there's a lot of anxiety. The anxiety level is high. You're like, oh my God, so much going on. Also so much fun, by the way, your own wedding. So, something really fun to look forward to. But this is the time, I spoke about skin boosters like Profilo and Nucleophil. They're usually multiple treatments. Profilo is done 2 to 4 weeks apart. For a bride, a younger bride in their 20s and 30s, I would say try and do it 4 weeks apart. You'll get the maximum effect, and try and have the second one a month before your wedding, because that's when your skin will just be absolutely the most glowing. Same with nucleophils, they work in a similar manner. And so you'll just get a better result for that specific day. You'll just, that'll be the culmination of your dewiness and looking as good as you want. And it'll continue. So you'll have it through your honeymoon and, the first few months of your marriage as well. So that's where you continue on. And so you continue on with the treatments that we were talking about before. If you're somebody who has pigmentation and redness issues, or you're somebody, maybe you have lots of sun damage on your neck and your chest and your décolletage, and you just want to even out your skin tone before you have your white dress on without having, makeup that might run onto the white dress, you can have those BBL treatments, those IPL treatments that I spoke about. And like I said, you need to have at least 3 of those. So you need to be able to fit those in. The last of which should really be 3 weeks before your wedding, nothing after that point. I would also say the same for any injectables. I would not want to do any injectables in your skin 3 weeks before. So really all of this a month before is like, that's it, just in case you get a bruise, or just in case, like one of the stubborn areas of pigmentation go dark and it takes a little bit longer for it to fall off or flake off. You will have that time and you won't be stressed out, because believe me, you'll have enough stress of other things that you'll be worried about than to worry about, having an issue with your skin. But this is also the best time to do all the touch-ups. So if you did do something for your underarms for hyperhidrosis, or you did a little sprinkle on your face for a little bit of the facial hyperhidrosis, or even flushing, you can do Botox. You can also have those touch-ups so that they're perfect before your wedding day. This is also a nice time a month before that you could do a little micro needling, nothing too aggressive, because remember, you don't want your skin to have issues or, to become angry. So you just do light ones just to make sure that your skin feels and looks the best that it can. And again, you supplement all of that with your home care, with your vitamin C, with your retinol, with your LED. So, these are the things that you can do at home without much, you could even be discussing, what you're going to be doing for your wedding while you have the LED on, or you have a mask on or something like that. So it's a really nice way to be able to get everything going for yourself in terms of getting ready for that. You want to be picture perfect, essentially. What I would also want to point out is what you shouldn't do. So you should not have any aggressive treatments. I would not have any ablative laser treatments within the month before your wedding. So if you are somebody who has acne scarring and you were like, oh, I just want to see if I can get it better, now is no longer the time to do that. If you miss that boat, then you do it after your wedding if it's still bothering you, but do not do it in that month beforehand. Laser hair removal, that's another thing that you could do a month before, because we know it lasts about 6 to 8 weeks. So that'll make sure that you feel as rejuvenated as you can without having to get a quick wax or, shave or whatever it is, however you want to remove that hair. And finally, I also wouldn't do any aggressive facials during this time, because picking at the face or being highly aggressive can also lead to irritation, and you don't want to get like that little red mark that just is not moving. So those are my caveats. Now, if you do, and you by accident, I don't know, maybe one of you are getting married soon, you've done a mistake and, oh my God, you got a bruise and you're like, how am I going to get rid of this bruise? There are some things that can be done if you go to a doctor with special lasers. We have such a laser. So sometimes people have an important event and they've gone somewhere and they didn't realize that they're going to potentially have a bruise. And then they end up, like I said, Murphy's Law, with this big bruise. And what we can do is we can zap it and help break it down a little bit. So you obviously don't want to panic about that just before your wedding. So not something you want to go down. Next, a week before your wedding. This is when the excitement's, at its peak. Everybody's flying in. You're getting all these messages. All the little details are coming together. Your parents are getting on your nerves if they're involved with it. This is where you want to just keep consistent with your skincare. Make sure that you have time for yourself. I love using ampules during this time. And for me, the Glow Boost ampules are something that are amazing. And they're, 5 days before the wedding. You break open an ampule in the morning and then one in the evening. They're very easily labeled. They have different light acids in them. And you place it as the first layer of skincare that you do to give you that glowing, radiant skin. I have never heard anybody have any sort of issue with having these Glow Boost ampules, but like I said, with everything else, you might want to try it, maybe the month before this, just to make sure, or a couple weeks before. But this is something that will give you an instant glow in that week. I love it for all major events. Very easy to use. It has a little sleeve, I call them, so that you can break it and, open it and then use the serum on the face. I actually put it on the neck and the hands and even the back of the arms if there's some extra. This is where you want to keep your skin as dewy as possible. LED light, as I mentioned, the red light will be excellent for this. If you feel that you have some events before your wedding and, you're wearing a lot of heavy makeup, or you're sweating and you're wearing makeup that you might not normally be wearing, then what I would say is that, use the blue light instead of the red light to try and calm that skin. Use a lot of the hyaluronic acid, which is a great way to keep the skin hydrated without irritating it. If you're going out and, I just was watching on Instagram, one of my friend's sisters got married, a big fat Indian wedding, and they had 7 days of like fabulousness in Venice. And I was like, oh my God, I'm exhausted looking at the pictures. And that's where, these types of things like the golden eye masks are a great way to depuff the eye, give you hydration, decrease fine lines and wrinkles. And I love putting it in the fridge for about 10, 15 minutes in the morning or whenever I'm about to use it to give it that little bit of refreshment. Really a great way to mask that you're really tired. But also just a great way to hydrate the skin, a really nice go-to. You can even put it on while you're having your makeup done on the day of having your wedding, so that you just, give your eyes just that little bit of a zhuzh. So again, what else can you do? This is the time that I would say, if you have a facialist or you've done a hydrofacial before, go back to that person, have a nice facial, have a nice relaxing facial, massaging facial with products that you've already been using, not something new at all, just to get the lymphatics going, and also just to relax you and let you enjoy that time right before your wedding. And as I mentioned, the LED is just my ultimate favorite go-to home treatment that you can possibly do. And finally, on the day of your wedding, I mean, everything is at its peak. Everybody's coming together. You have your makeup, your hair, your dress, everybody, your friends, your bridesmaids, if you have them, your parents, the in-laws. And of course, you want to look your most beautiful for your groom or whoever your partner is. And this is the day that masking is the perfect way. You wake up, put your nice gold eye masks on, let them sit there, take it all in, do a little bit of meditation even with your eye masks on, so you can, clear your head and really try and enjoy the moment. It's a little hectic. Just remember, on that day, only you are going to know any of the shortfallings. No one knows what you were planning. So if something's not absolutely perfect, it might irritate you, but no one else is going to know. So don't tell them. But really just, use your eye masks, refresh yourself, put on the LED, give yourself a moment to take in this really fabulous day, obviously one of the biggest moments in your life, and, try and relax. So I think that's, really important. And, what I love about this is that this automatically gives you a glow and makes you feel well. So this red light is also just such a lovely way to make you feel good. So you'll feel, I don't know, you could be getting married in the mountaintop or in Antarctica, but you put this mask on and it just makes you feel warm, not hot, because it actually is not hot at all, but it makes you feel like you're in a happy, sunny place. And again, for the mood, it's really fabulous, but also for all those collagen stimulating benefits. And again, 10 minutes, it takes no time whatsoever. So you can do this before you have your makeup done. And I think with that, that's most of what I would say is the way to go forward. I did that so fast. I think I was talking really fast. But what I would say is that, try this moment. You'll see when you get married, you think you've been preparing for so long, it goes in a split second. The wedding's over and the next day you're like, did that happen? It was the best day, night, whatever of your life. And then you're like, that went by so quickly, all that effort for just a quick party and a lifetime memories to make. But, it's really important to try and relax. Obviously, way easier, better said than done, because I'm on the other side of it now. I've been married a very long time. I was about to think about it, but I think it's like 2006, so 16 years. But it feels just like yesterday. So, and I still remember my wedding and it makes me smile. So, you will look your most beautiful on your wedding day, no matter what, because you will have the biggest smile. And remember that the most beautiful people are the ones who are glowing from the inside. So if you can take a moment to take it all in, have your eyes sparkling, make sure if you're getting married now and you have allergies, you take your allergy medicine so you're not sneezing or your eyes aren't red. There are some nice eye drops. I don't recommend them all the time, but there's one called Sustain that you can get on Amazon, which is a really great way to keep the whites of your eyes white without damaging any of the blood vessels there. You will probably not eat much on that day or even drink much, but make sure you drink plenty of water. The day goes by so quickly that you just don't know what's going on really. So I would have somebody and say, can you come to me every once in a while? And I don't know, put a veggie in my mouth, or I don't know, put something, give me something so I can, you're sustained. You're going to have so much adrenaline going on that you're not actually going to need any food. Now, the last thing that I would want to say is that in the week before your wedding and in the weeks before, a lot of people change their diet. And obviously, that's always a great way to decrease your glycemic index, try and take out refined sugars, obviously, all the things that But if you can do it the few days at least before your wedding, then you can at least feel like you're not bloated, and try to stay away from carbs and refined sugars so that you feel that you look and feel your very best. Because sometimes if you feel you don't look your best, then it affects your mind and the way that your state of being. So that's my 2 cents on maintaining a well-balanced diet. But at the same time, you should enjoy it. Don't drink too much, but definitely, have a glass of champagne. And if you're drinking, make sure that you're using lots of water, because the last thing you want is to, the night before at your rehearsal dinner, or whatever it is that you're having, drink a lot and then wake up the next day with sallow, dehydrated skin. So for every glass of whatever it is that you're drinking, make sure you have at least 1, if not 2 glasses of water to chase it. Just my 2 thoughts. And that's it. Enjoy, have fun. You can shop all of our products, online. We have a discount code. It's called Wedding. So you can get 15% off. And as I mentioned, if there were a trio of products from our, line that I would say you should be on, it would be for skincare, it would be the retinol, the vitamin C, and the hyaluronic acid, because those are the things that are going to constantly give you a boost and are going to make your skin the most visibly beneficial. And then finally, this LED is just like an investment. You can use it for your wedding. You can use it after your wedding. If you have grown kids and you're getting married, they can even use it for the blue light if you clean it properly. So it's just a really nice at-home treatment. I also wanted to say, if you have any questions, or I'm not sure if we can make it open in terms of asking questions out loud, but you can write it in the chat. I'm going to just look, because I did see there's some bits here. Let's see. So someone said, very good question. So I usually get spots whenever I need my skin to behave, of course. Oops, where'd it go? What do you recommend for this on the day of an event? So depends on what day your event is. So if unfortunately you have something that pops up just on the day of your event, if you have access to someone like me or a dermatologist, you can go and have a very quick cortisone injection that will immediately, it won't make the redness go away, but it will make, if you have a volcano, go down a little bit. The other thing that I would say is that you can put ice, take an anti-inflammatory like an ibuprofen, and I would use a hydrocortisone cream on top of it, because sometimes that can just take the inflammation down a notch. So excuse me, I don't know if I said hydroquinone. I did not mean that. A corticosteroid. So you need a cortisone, why do I keep saying hydroquinone? You need a hydrocortisone cream to be able to put on that, because if you use anything else, it's not going to dry out in time. It's not going to make it go down, but that is an anti-inflammatory cream. It's over the counter, and it can help decrease the height. And then, I know you don't want to necessarily have a red mark on your face, but a red flat mark is a lot easier to cover than something that's quite high. What's the right order of products to use with the vitamin C, the ampules, retinol, and the night serum? So very good question. So as I said, you should always use the lightest consistency first, and then you move on. So, if you're using the ampules, I'm going to go through and pretend like you're using all of them. So if you use the ampules, you cleanse your face, you open one of the ampules up, you place it in your hands, you place it all over your face, your neck, your décolletage, backs of hands. You let that sit there until it's dry, just so that the absorption happens. And then you use the serum, and then you use the most medicated serum first. So if you were going to use Brighten and Perfect as well as the HA serum, I would put the Brighten and Perfect on first, 2 pumps again on the face, neck, décolletage, and then I would follow that with the hyaluronic acid. And if you were going to put a moisturizer, you could put a moisturizer. Most people, they like the hyaluronic acid with these two, and then they put on their SPF, and then you're done. And if you have the eye cream, of course, you put the eye cream on before, at the same level of this when you put the serums on. Now, at nighttime, again, you would open up your ampule, break it open, put it on your face. If you're using your eye cream, you put your eye cream on upper and lower eyelids, and then you would go with your serums. So again, if you were using your hyaluronic acid serum, you'd put this on. If you were using Rest and Revive, you would put that on. And then finally, you would put on the retinol skin booster, because an oil is always the last thing that you put on your face. Remember, it's like if you put something on top of an oil, it just won't penetrate. So you might as well not bother putting anything else on top. And which serum should be used with the LED mask? That's a great question. So you don't actually need any serums with the LED mask. I would not use actives. So do not put the vitamin C on. Do not put retinol on, because they can become unactive with LED light or any light in general. So what I would do is I would wash my face, and with a clean face or with something like hyaluronic acid or the Rest and Revive stem cell serum, that's what I would put on for this, because it has better penetration. I wouldn't use it with a retinol, because you could have too much activation and vitamin C will become deactivated like that. So I would only use the hyaluronic acid or the Rest and Revive in this product, or anything that's very light and is more for hydration for better penetration, but without actives. That's a very good question. Let's see. So any other questions for me? Nope. I want to thank you all for joining. If you have any questions, you can always reach out to me on MZ Skin Official on our Instagram, or on Dr. Maryam Zamani. Always like to help where I can. And yeah, I think that's it. So I'm just going to check one last time to see if there are any other questions. But I don't think so. Thank you so much for joining. And